Can everyone hear me okay? I'm going to try to keep my mask on. Welcome and thank you for being here today. For those of you I haven't met, my name is Albert Wright and I have the privilege of being the President and Chief Executive Officer of the West Virginia University Health System, and we're here today to talk about a partnership we have here in Monongalia County as we start to work more closely together. You know, we're all in this together on COVID, and we're trying to figure out, you know, how do we get back to normal, and we realize the only way we're going to do that is to vaccinate our way out, right? So, you know, today we're celebrating bringing together not only the West Virginia University Health System, the Mon Health System, our county commissioners, our county health department, and we've created a large-scale vaccination site here, you know, so that as vaccine becomes available, we can get vaccines in the citizens of West Virginia's arms as soon as we have it. And we've built this great center that you'll see today that we can vaccinate up to 8,000 people a day. And, you know, and we don't have enough vaccines for that right now. But as those vaccines come in time, we want to have the infrastructure in place that allows us to be ready the minute those come. And we found that by working as partners, we can create that sustainable infrastructure. This site will be able to vaccinate up to 8,000 people a day, 6 days a week, so, you know, upwards of 48,000 vaccines a week when we're fully up and running. So, you know, today we're actually in an old Sears building in the Morgantown Mall. We're vaccinating 1,000 people today, and we're only going to let that grow. I want to recognize a few folks that are here with us today. Up at the podium later on, we'll have Dr. Lee Smith from the County Health Department, Sean Sikora, who's the President of the Mon County Commission, my colleague David Goldberg, the Chief Executive Officer of the Mon Health System, and we all know Dr. Clay Marsh as the czar of the coronavirus in West Virginia. We've got some members of the County Planning Committee here. Rebecca Thomas. Rebecca is the CEO of Clay Patel Community Health Center. Thank you, Rebecca, for being here. Jimmy Smith, who is the Director of Mon County Emergency Management. Jimmy, where are you at? Jimmy's out. Oh, there he is. I thought he was out managing emergency. And Lee Smith is obviously the Executive Director and County Health Officer for Mon County Health Department. We also have Sam Chico, who is the Chairman of the Mon County Board of Health. Sam, where are you at? Thank you for being here today. We have our other two county commissioners, Tom Bloom. Thanks, Tom, for being here. And Jeff Arnett, thank you for being here. And finally, we also have General Hoyer, who's done a great job managing the vaccine distribution and so many other things on the coronavirus pandemic. So thank you for being here. But most importantly today, we have via Zoom Governor Jim Justice, who has done just a spectacular job, in my opinion, not only treating, you know, guiding us through the COVID pandemic in all of West Virginia, but his dedication to transparency and communication. And, you know, as we all know, West Virginia is leading the country on vaccine rollout and getting vaccines in arms. So thank you, Governor Justice, for being here today, and I will turn the virtual podium over to you.
Do. I love it that you've got your mask on today, but I hate it also as well, you know, that we're having to do this, that we're having to do it by Zoom and everything. But if I could just touch on just a couple of things, you know, there's so many to thank. You've got the elected leadership of Mon County, you've got Mon County Health Department, Mon County Health System, WVU Medicine, and all the other people that are really rolling out this incredible super hub is basically what it is. It's a super hub model that can absolutely quickly get shots in arms, and that's what it's all about. When it really boils right down to it, it is absolutely just this. We have pulled the rope together. All West Virginians have done so, and we could have fragmented time after time. There's frustrations, we all get that. We've all kept pulling this rope together, and West Virginia has done great because we've just done just that. It's been a real effort on my part from the standpoint of keeping us together. You know, I love what Albert just said. You know, we're going to vaccinate ourselves out of this terrible pandemic. And we are. We all knew that we were trying to remember all the words that I said to you months ago. We're trying every way within us to build a bridge to get us to the vaccine. Now, there's many people that deserve a lot of thanks. You know, whether you're a Republican or a Democrat doesn't really matter to me. At the end of the day, we should now support our president, our new President Biden, and we should be thankful to our President Trump for all the good work that he did as well. We absolutely should support and respect the presidency in every way. Now, but as we move forward here, just think about this. West Virginia continues to lead the nation over and over and over. You know, whether it be the nursing homes or getting everybody tested, and now fast forward to all the stuff we're doing in regard to the vaccines. We need more vaccines, don't we? We keep pleading our case, and we will end up with more. But in the meantime, if you don't have your vaccine, or even if you do, wear your mask. It's as good as a vaccine if you'll absolutely wear it and do the right things there. But absolutely, at the end of the day, with partnerships like this, with great West Virginians working together, like you've done, like we've tried to do here, good stuff is going to happen. Now, I want to read this last paragraph, and I mean this because you know me well enough to know that I try with all in me to always tell you the truth. I'll make mistakes, but I'll always tell you the truth. And again, I want to thank everyone that's there, that's in the great county of Mon County and all the surrounding counties as well. I want to thank the people from Mon Health. I want to thank, the people from WVU Medicine, the Mon Health Department, and the Mon Health System, and all these people that are in this great area in north central West Virginia that are making one thing happen. We are saving lives, people. Do you realize that we've really got to squeal out of the pig, 106.4% of the doses that we've received, we just reported at our briefing, 106.4% are in somebody's arms. Do you realize we've almost got 80,000 65 and older people with shots in arms right now? Absolutely step back and really be fair. Really be fair. Because this is what you're working on right here. We were told by the federal government, we were given models by the federal government, we even developed models ourselves that basically said for the general public, people that were 65 and older, we were going to get to you in April. Well, it's January. It's January, and we've got 80,000 right now. 80,000 right now. And what you're doing is going to save up to more lives. How many lives have we already saved? We know we're the third oldest in the nation, and we're bound in the most chronic illnesses. You are saving lives like you can't imagine. I'm going to end with just this. I looked at Kathy probably 10 days ago, and I said, Kathy, do you realize just this? We've got 2 little grandbabies right now. We got, and Kathy loves to be with them, and I do too. It's been tough because there's been a lot of work that's had to be done. Kathy's able to be with them way more than I am. But now just think, just a second. I told this to Kathy. I said, Kathy, you realize that really both of us are over 65. Do you realize, Kathy, that how would it be if really you were to get sick? How would it be if you were gasping for your breath? How would it be that really and truly you didn't make it? How would it be the fact that maybe these wonderful grandchildren that we have would not even know your name, would not remember you in any way? How would that feel? And how would it feel if I were to tell you, Kathy, That is happening to people like you and I every single day. Every day I go in and I read name after name after name. You, in what you're doing, you are going to save all kinds of lives. You are going to prevent that from happening all across our state. I can never thank you enough. Albert, you're doing a great job. All of y'all are doing great work. You know, President Gee and everybody that's involved, David and all y'all that have been mentioned, our commissioners and everybody. From the bottom of my heart, I love you and I thank you so much.
Good morning. My name is Lee Smith. I am the Executive Director, Montague County Health Department and County Health Officer. And I'm privileged to follow Governor Justice's comments. And I just have a few brief remarks. To start with, 10 months ago it would have been difficult to predict what it meant to have a response to the public health issues of this pandemic. Now, there certainly have been many twists and turns along the way, and your local health department has been asked and has performed everything that has been asked of it so far. We performed and we still perform. Even this morning we did the COVID testing. We still do the disease investigation and contact tracing. And now we are involved in vaccination. And since December 15th, Montague County Health Department has done over 4,000 vaccines. And lastly, this is all going on while we are attempting, to the best of our abilities, to do our mandated public health services, which include family planning, women's health, tuberculosis, STDs, breast and cervical cancer screening, and other services that we've struggled during this pandemic. Now, many accolades have been laid on the table of public health, but these generally can be attributed to the relationships that we have had in a pre-existing manner with all of the various services throughout the county. And I'm always interested to hear our federal partners remark about how they are surprised at how well things get done in a rural environment. And I think it comes to our realization that we know that if it's going to get done, it's going to get done by us. And so we are self-reliant in that matter. Now, Montague County Health Department is small, and we are feeling the strain of ramping up efforts to get the maximum number of vaccines out to the population. And I have often remarked that our health department lives between two giants. Mon Health System is our county hospital, and West Virginia University Hospital is a quaternary hospital system in many parts of the state. It is only through the addition of these resources that we can reach the next plateau where hopefully we'll be able to look over the Jordan River and see some of the end of this pandemic that has killed so many West Virginians and hospitalized many more. Therefore, Montague County Health Department is extremely proud to enter in this relationship with West Virginia University Hospitals and Mon Health System, and so that we can join forces and pool resources and obtain more vaccinations and be able to ramp up our efforts to get the maximum number of people vaccinated and hopefully see an end of this pandemic. Thank you.
Hi, good afternoon. My name is Sean Spore. I'm the president of the Montague County Commission, and I appreciate everybody that's here today to listen to our announcement. First, I'd like to recognize the other individuals that are here. Dr. Smith, I I can't thank you and your health department enough. Any county in the state would love to have our health department. In my opinion, it's the most professional and effective health department in the whole state. And I really appreciate all the work that you and your staff do. You guys have been on the clock since March, 7 days a week. I mean, you're just burning the candle at both ends, and you continue to raise the bar on how we approach this pandemic. There is no playbook for dealing with this pandemic, and you're putting out the fire as you're writing it. So thank you so much. And this isn't the only, I mean, there's examples like this that our health department exceeds the state and the country. Countless examples. Our QRT program. If everybody remembers the opioid epidemic, well, that's still going on. And our health department created a quick response team called QRT team that other states, other counties, we have a mentor-protege relationship with Madison County, Kentucky, to take our program and bring it there to help combat this epidemic. So our health department is a leader across the country, and I really appreciate everything you've done in regards to this pandemic. Another example, and one of the things I'm most proud of, and again, I'm the representative to the health department, so I'm very proud of our health department. But one of the most proudest moments I have with our health department is their dental unit. They created a Smile Express program that can reach all corners of our county to provide dental assistance to kids that otherwise wouldn't get that care, and then be subject to a life of self-consciousness. And if you give a kid a smile, you give them a chance at life. And I'm certainly proud of that. And before the pandemic hit, we had 7 counties, and we were bringing that service to other counties. So thank you so much, Dr. Smith. The citizens truly owe you and your staff a debt of gratitude. W Hospital, Albert. In the short time that I've known you, when you say something, that you're going to do something, it gets done. I really appreciate your wisdom, your brute force that you bring to projects. We work together on the ambulatory service agreement, which a lot of you in Mon County know about, where we merged the county ambulatory services. And that is a very, very successful operation that wouldn't have happened had it not been for your vision and your willingness to not even put aside the needs of your organization to work for the betterment of our citizens. So thank you very much. We're really lucky to have an organization like yours in our county. Mon Health, David, in the short time that you've taken over Mon Health, you've completely transformed what already was a world-class organization. Again, back to the ambulatory service agreement. If it hadn't been for your foresight and your management skills and your communication skills, we would have never got to that agreement. I think Albert would agree. And our citizens owe you a debt of gratitude for that. Both of our medical institutions, any county in the state would love to have one of these institutions, and we've got 2. And sometimes that's a good problem. That's a good problem because there is competition. Obviously, naturally in life there's competition, but we still work together, and we can put that aside to come up with work together on a project like we have here today. Our state partners. I don't know whether Charleston still listens, but Clay, we realize Mon County isn't easy to work with in Charleston. We could be rough around the edges, but I go to commissioner conferences across the state, and other commissioners say, "Wow, you guys got a lot going on there, but you got good problems." But they're problems nonetheless, and we don't just come to Charleston with a problem and say, "How are we going to fix this?" As a project manager, I like to tell my staff if you're going to bring me a problem, bring me a solution too. And I think we do that with Charleston. Exit 153 is a perfect example. We needed an interchange, and not only we brought the project to Charleston with a way to repay it and a plan to repay it over 10 years, and we kept our promise and paid it off in 3 years. This project is no different. We're bringing Charleston a solution. We can, if we push it to 7 days a week, we can push out 56,000 vaccines here a week. Just think about that. We could vaccinate the whole state of West Virginia in 32 days, and have everybody have their first shot. If we ran this facility full bore. So we're here to offer this offer this solution to the state to help the state, because it helps everybody in the state. If we can show that every vaccine that we get here in this county, that it's going to efficiently go out as soon as possible. So lastly, I'd like to thank my fellow commissioners, Tom Bloom and Jeff Arnett. I want the citizens of Mon County to realize that your commission is very nimble and proactive. This all started with Albert giving me a call saying, hey, I want to show you something. And I asked Tom and Jeff, hey, come on, let's go up to Sears and take a look at this project. Jeff and I know the commitment, but Tom and I came up, we talked through it. The next day we had all the parties involved in the room discussing it, and we left 45 minutes later with an agreement in principle. So I thank you guys, because we're three. We don't make this. I don't make decisions. We all three make decisions, but we all work together for the betterment of all of our citizens. So thank you for everybody, and Dr. Marsh, please. We're willing to help and work with Charleston anyway, but I think Charleston is really the key for this, or Charleston to see that we can do this here and to help us help you end this pandemic. Thank you.
Well, good afternoon. I'm David Goldberg, and I'm the president and CEO of Mon Health. First, I want to thank the governor, Dr. Marsh, General Foyer, and our state for its leadership. Albert and WVU Medicine, outstanding. This is what it's all about. It's about our patients. It's about our community. And coming together under Dr. Smith and the health department's leadership and bringing all of our resources together is what it's about. And while President Sikora was absolutely right, we don't compete when it's about the betterment of our community. And here we are here today to be able to bring all of our resources, whether it be people, vaccine, to be able to get to the masses quicker. So to Albert and your team, this is an outstanding demonstration of what WVU Medicine is all about. And on behalf of Mon Health, our board of directors and our people, we couldn't be more pleased to participate, to be able to round this out, and to be able to support Lee. So on behalf of us, thank you, and we look forward to seeing lots of people here so we can, bend the curve, vaccinate our way out of this, and to be able to drive what we know has been the worst situation we've lived through in 100 years to a brighter day. Thank you.
Well, thank you for having me here today, and thank you for this terrific partnership. Walking through this facility does bring hope for people, because many people are waiting to know when they're going to be vaccinated, how they're going to be vaccinated, and to be able to have a facility and an operation like this, and the partnership that we've heard today, is really the reason why West Virginia has done so well during this pandemic. Many people will have seen some of the media coverage that is part of the reflection of the great work done by the leadership team, certainly including Jim Hoyer, who's here today. Jim, thank you for your 40 years of leadership to the state and for your direction of the Joint Interagency Task Force over the operations of this vaccine distribution. Thank you to our county leadership. Amazing, amazing. I'm a resident of Mon County, so I know how amazing it is. And thank you, Lee, for your leadership, and certainly Albert for building this kind of world-class facility, and David for your partnership and with Mon Health. But I think that the important real message here is that it's great to get great press. It's great to have press conferences and to have national news organizations wanting to know what West Virginia does, and international organizations that want to interview us. But the key is we work together because we want to make life better for every West Virginia resident. We want to save as many lives as we can, and we want to share any information that we have that could be helpful for anybody else, and we want to learn from everybody else. This is really today about COVID, but in the future this is about the health of our state, of our county, of our country, and the citizens there. So thank you very much for being here. Thank you all for what you do. Amazing, amazing. Thank you.
So thank you, Dr. Marsh and everyone else. So, today's our big splash to announce our partnership, but going forward on a day-to-day basis, we will quietly be here vaccinating everyone eligible as they come and as we have vaccine together. And in this facility, you'll have employees from the Montague Public Health Department. You'll have employees from the Mon Health System. You have employees from the W Medicine Health System all working together and, to vaccinate our way out of this. So thank you for being here today. We got time for a few questions if anybody has any questions for any of us here today. Well, we were so comprehensive. All of your questions. Any group questions? So the question is, does anybody have any idea in the what the ramp up in availability of vaccines will be? I will say that, as we get allotments for either of our health systems or the public health department, we'll put them together here. I know the state is being aggressive on trying to get more vaccine. Maybe General Hoyer or Dr. Marsh will let you share any updated thoughts.
So unfortunately, right now, based on the national production schedule, West Virginia is only getting 23,600 first doses a week. Our objective would be to try to get a minimum of 125,000 doses a week. We know we have a population of 350,000 people over the age of 65. The sooner we get to those, the quicker we're going to reduce hospitalization and death rate. So, unfortunate circumstances, the federal government does not have the capacity right now to get us more, but I can tell you that, as Blake can attest to, Governor Justice is hammering us every day, and we're hammering everybody in the federal government to get that changed.
Thank you. Other questions? Juicy rumors. Today here, I think we're right around 1,100 today. So we're, we started last week, the first couple of days, we did 500. I think we got about 1,100 today, 1,100. And then, we've got the capability to go up to 8,000 a day once we get the first and second dose days. So lots of capacity still. Good question. Other questions? If not, thank you everyone for being here today, and much appreciated, and look forward to working with our partners, and please be safe. Thank you.
Excellent day. John, well done. Thank you. Good job.
Good job. Thanks.